Good afternoon, everybody. I am Sanya, your host for today's live from All About Skin Wellbeing team. I am sure all of you must be keeping good health. Today, we are going to discuss about our skin healthy with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch intensely, and it may due to chemicals in certain foods, allergy due to certain medications, insect stings, sunlight, and sometimes the cause is unknown as well. As per study published in Indian Journal of Dermatology, Venerology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. Urticaria is classified as acute and chronic. But the most part is important part is not to ignore it and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or a blessing that we can get to hear from the expert dermatologist online about urticaria and its type and how we can prevent it. The kind of test which is required for its diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us today renowned dermatologist of India, Dr. S. Swathika. She is a dermatologist, trichologist, and venereologist in Tambaram, Chennai, and has an experience of 13 years in this field. She completed DDVL from Rajamuthaya Medical College in 2012 and MBBS from Annamalaya University in 2008. Dr. S. Sothika practiced as dermowear, advanced skin, hair, cosmetic, and ENT clinic. Some of the services which she provided is skin biopsy, wart removal, acne or pimple treatment, glutathione, skin whitening, horn removal, laser hair treatment, chemical filling, medifacial, botox, and fillers. A very warm welcome to Dr. Swathika Udayakumar, and it's a pleasure to have you with us today.
Thank you. Thank you for the elaborate introduction about me. Thank you.
Thank you so much, Doctor. And Doctor, as today we are going to discuss about a very important topic that is urticaria. And as in India, monsoon has already hit to all the cities. Urticaria, and we were talking about the round rash. Have started? I might think that patients have might started coming to you that the round rash and itchiness is there due to monsoon. So, what is basically, if we define urticaria? So, what is basically urticaria, doctor?
Urticaria we usually define as a reddish erythematous rashes. Erythematous in the sense reddish rashes which develop over the skin as well as on the mucosal regions also, which includes your lips or genitals, and the urticaria can even set in on the scalp also. So it will be classified as acute and chronic. Acute urticaria, if the symptoms persist within 6 weeks, is the time limit. If it is within that period, it is acute urticaria. If it is more than 6 weeks, 4 to 6 weeks, it's chronic urticaria. So people enter with various symptoms in the clinic. Like I had itching for the past 2 days, or rashes over the legs, over the hands, or all those symptoms, which the duration will vary from person to person. According to the duration and according to the symptoms, we have to first classify whether they come under acute or chronic, and then the treatment starts from there.
Okay, so as you said, there are two types of urticaria, that is acute and chronic, and more than 3 weeks is chronic urticaria. And doctor, it can be acute or chronic, but when we talk about the causes, so what are basically the causes of urticaria? And sometimes how can we know that due to this urticaria has happened?
Urticaria is actually a general term which means that you will be having rash, you will be having redness, which will vary from person to person. And as I already said, the duration also it's important. Coming to the causes, any skin diagnosis, anything like urticaria or whatever things, it is multifactorial, which means that it has a lot of etiologies, like the food what we take, the exposure to sunlight, or exposure to air, exposure to the work. There is also occupational reason, and apart from that, people who are traveling a lot, who take a lot of junk foods, all these things can precipitate urticaria. And next, a very important point is that stress is a very important thing which triggers urticaria nowadays in the recent years, because people work at odd hours and sleep at odd hours, so that the stress hormones are released more comparatively. As a result of this, there is a substance called free radicals which is being released into the bloodstream and which is responsible for triggering this urticaria. So all these things are just a few reasons which are triggering urticaria.
Okay, so these are the different causes, as you said. People are taking junk food, they can have urticaria. And if somebody is, traveling a lot, they can also have urticaria. So there is like a lot of causes, right, doctor?
Yes, yes.
So urticaria can be caused by any thing, eating junk food. And as doctor said, stress can also be part of urticaria, and it can also cause urticaria. Doctor, when we are talking about the causes, if someone have urticaria, how he can identify that this is particularly urticaria? How does it look like? And it's an allergy, like it can spread from, sometimes we have seen that if someone itches, or someone is continuously scratching the urticaria part, people usually, stay away from that person, feeling that, it can happen to him or her. Is it like that? It is allergy which can, pass from one person to another, or how does it look like, and how can somebody identify, that this is particularly urticaria and it is the right time to go to a dermatologist?
First of all, urticaria is not at all a contagious condition. It won't spread from person to person. It is concerned with the individual alone. One thing. The next thing, though there are various descriptive terms regarding urticaria also, a normal layman term will be that there will be appearance and disappearance of lesions. Patient will have itching or redness of lesions or irritation on odd hours. So they will be thinking in the morning we should go to a doctor for this consultation. Like that, people will be thinking is that in the morning when they get up, they won't be having any lesions. So that's why it is known as there will be appearance and disappearance of lesions. So people would be wondered, now I don't have any lesions. When I go to a doctor, what will I be showing? There will be no lesions, and how can they identify? When they tell the history itself, we'll come to a diagnosis that it's urticaria. So when they tell, yesterday I had the lesions, now I have only the itching, but I have no lesions to be shown, is itself is an indication that gives a clue to the diagnosis that it's urticaria.
Okay, so that means a dermatologist can identify that somebody have urticaria because it can disappear, right, doctor? As you said, it is
Yes.
a disappearance and appearance factor. It has. Okay, so this is something in night you are itching and you have urticaria, and in the morning it disappears.
Yes.
Okay, so doctor, when we were talking about the types of urticaria, as you already told that there are two types of urticaria, that is acute and chronic. If we talk about the chronic urticaria, does it look different, or how can someone identify that this is particularly chronic urticaria hives, and how will they go away? Like they need a proper treatment, or that as you said, it is a disappearance and appearance factor. So how can somebody identify that this is a chronic urticaria and this necessarily needs medications? And how does it look like? Is it like how the acute and chronic urticaria are different from each other?
Acute urticaria will, the duration will be, as I said, within 4 to 6 weeks. and the intensity will be less comparatively. There will be just mild itching. The redness of the lesions will be just coming and it will disappear. People will be taking some emergency drugs over the counter and it will respond immediately. After that, when it comes only, people will be worried about it and they'll take another tablet, and if it will be going on few months together. After that, if it crosses the 4 to 6 weeks, and they'll come to the clinic and say, when I take the tablet, it's responding. When I stop it, it's getting worse, and like that, then it is an indicative that they come under the chronic urticaria. So we have to decide according to that, and then we have to proceed on with the treatment.
Okay, so I am sure that many patients come to you as well. They have treated self-medicated, go to a medical shop and itching is happening. Please give me a tablet or something like that. But urticaria is coming again and again. So that is the sign of a chronic urticaria.
People when they get itching or a rash, no one will be coming immediately to the clinic anywhere. They'll go to the shop and they'll get a cetirizine, is a universal drug which everyone knows. So they'll take a cetirizine tablet and they'll apply coconut oil and whatever home remedies which were being practiced in the olden days, it will be carried out. If it is not responding, then they'll rush to the clinic.
And I think that is what everybody, they find a simple solution that go to a medical store and or a home remedy would work. And sometimes I think doctor it work also in some patient, but it is important to take care and consult a dermatologist if it is coming again and again, or it is not reacting to your urticaria.
Yeah, the thing is that what we want to convey is that when you take a single tablet or do home remedies, it is just a temporary stay of treatment.
Right.
Taking a cetirizine tablet is not a very big thing which will affect. But coming to the home remedies, when you apply certain home remedies, whatever you have been suggested, when you apply that, it will sometimes you will find that it has settled down, but it's not like that. It's going to get absorbed, and the problem is going to get deepen and widen, and the particular patient is going to face the same issue in an increased way after a few days or months together.
Right, right. And doctor, here comes, the question that when we're talking about the treatment, that usually people do it by like the home remedy or, self-medicate. So we would really like to know that if urticaria is not treated well or if left untreated, what are the necessary complications which can occur in a person if they have not treated urticaria?
If first when they enter, the person enters, we have to identify, we have to collect the history and then classify them as acute or chronic, and then according to that, medications have to be given to control the histamine release which is being happening inside, which is responsible for urticaria. So after that, we'll be giving the tablet form as antihistamines like cetirizine or levocetirizine. There is a group of drugs like H1 antihistamines and H2 antihistamines. All those things will be given. With that, we'll be giving topical medications, the creams and all to be applied also externally, to be applied to control the reactions. If it is not responding to the treatment, we'll go on with the blood tests.
Okay. So as you mentioned that, that if the medicines are not working, so we go to have to a blood test. So why are these lab tests are important and why they are needed?
And the lab tests are needed to identify certain underlying causes. We can come to a diagnosis that it's urticaria, acute or chronic, and then we can carry on the treatment. If it is acute urticaria, we'll give the tablets, cream, and lotions, whatever thing has to be followed. And initially, we'll watch for around 2 weeks. We'll see how it is responding. And after that, we'll go on with the blood test. Why we have to do the blood test is that we have to rule out certain underlying causes. For example, what are the panel of tests which is being done is that we'll be doing a complete blood count. We'll be doing ESR, a thyroid profile, then CRP, C-reactive protein, then ASO. These are a few panel of tests which is being done. For example, if the patient has underlying anemia which has been unnoticed for a long time, uh, people would not be having symptoms at all times. So if it is being unnoticed, even anemia also can precipitate urticaria. So that the treatment for urticaria will be given with that added, the treatment for anemia will be added with that, so that the underlying cause will be eliminated and patient will also be free of symptoms.
Okay, so that means all the the history of a patient, that if someone is also suffering from another disease is being taken up. That's why the lab tests are important.
Yes, lab tests are important. Like we do a thyroid profile. Why we are doing is that there are various classifications of thyroid disorders. A simple classification is hyper and hypothyroidism. If the levels are also low, or if the level of thyroid profile is also high, that will also precipitate urticaria. For that, we do a panel of blood tests. And if the tests are normal, then there is no need to proceed anything. We can give symptomatic treatment. If the tests, anything has to be, underlying cause has to be identified and corrected, based upon that, the correction will be added.
Okay, so it's better to consult your nearby dermatologist as soon as you see that your urticaria is not treated well, and it is not going as we have mentioned, that it can disappear and appear. But if it is not going and you are having problem, you should definitely go to a dermatologist, because it is important to treat it as soon as possible. Doctor, when we are talking about the urticaria, is it like that, due to, as you already told, that junk food also causes urticaria, and there are so many food items which can cause urticaria. Are there any dietary precautions or do's and don'ts someone should, already take, that should not cause urticaria in future, or if the urticaria is repeating in a person, so what are the do's and don'ts, dietary precaution one should definitely follow?
Yes. Why I told in particular about junk food is that the packed or the frozen foods or junk foods, whatever people are trying to have nowadays, what everyone has, a lot of preservatives will be added in that to maintain a long time. So those preservatives also will trigger urticaria, and that's one of the very important reason. So for that purpose, we tell them not to take junk food or frozen food or any food from the Tetra packs, all those things. Other than that, even normal food, what we are taking from home, like milk, egg, fish, peanuts, all those things also can trigger urticaria.
Okay, so there are a lot of things which can trigger urticaria, uh, uh, as you told, that the food, and if you know that this particular thing is triggering your urticaria, you should avoid that, right, doctor?
Yes.
Yes, so you
There
should.
are also specific tests for that also. We can also do the food allergen test. We can also identify the, even patients can develop urticaria or allergic reactions to certain medicines. And we can also carry out those tests and we can identify to which particular medicine patient is developing this urticaria or any other allergic reactions like that. And we can proceed on with that.
Okay, so we have to test it properly, that what are the reasons of urticaria, why someone is having urticaria, or this medications, or this proper food is causing the urticaria, because sometimes sunlight also triggers the urticaria. Someone went to a garden and come back and they're like, I don't know why it is itching. Is it sunlight a proper triggering effect for urticaria?
Yes, that also comes under solar urticaria. Solar urticaria is that the skin, it in olden days, it didn't have any rays like this, like UVA or B or C or all those gamma rays or cosmic rays, which were very harmful to the skin. Those rays were not that much in those days. But now it is penetrating up to the dermal level these days. And so it's producing solar urticaria also. And there is also sweat induced urticaria. So those things also can trigger urticaria.
Okay, and in summer season also, we also sometimes feel that wearing some kind of clothes, you produce a lot of sweat, and then we feel itchiness and all. So, what is the do's and don'ts if of urticaria can happen in summers?
So in summer, the dress what we wear is also very important. We shouldn't wear too tight dresses or some synthetic material or jean. All those things have to be avoided first thing, because when you wear tight clothes like that, that will also trigger urticaria, which is known as physical urticaria. Either tight dresses or your tight socks or any tight blouses or like that, which is of synthetic material, all those things also will trigger. So in summer season, it's better to wear a loose fitting dresses which provides aeration sufficiently.
Okay, so in
That will,
summer, yes, doctor, please.
that will also reduce the symptoms basically.
Okay, so in summers, you have to take care, by wearing loose clothes and so that air can pass it on. And as now we are hitting monsoon, so what are the precautions one should take in the monsoon season, doctor?
Yeah, in the monsoon also, even we have to, in the day, we have to put the proper sunscreen, and in the night, we have to apply the moisturizing lotion so that the urticaria symptoms will not be triggered that much.
Okay. So please take precautions in the monsoon season as well. Doctor, the viewers watching this live also have some questions. So the first question is by Kirti Kapoor, asking how common are dermatophytes and are they related to urticaria?
Yeah, dermatophytosis actually, it denotes a fungal infection. Fungal infection, if it is not properly treated, then the infection, it will be increased 1 point, and that will also lead to urticaria.
Okay.
So a proper treatment for dermatophytosis have to be followed.
Okay, so as doctor said, proper treatment for dermatitis has to be followed, and because if they're not treated at the right time and at the right direction, it can also causes urticaria.
And sorry to interrupt. And of course, urticaria is not a contagious condition, whereas dermatophytosis, a fungal infection, is a contagious condition if it is left untreated.
Okay, so you have to be, precautionally aware that dermatitis is a contagious. It can spread from one person to another, as we have already discussed. That urticaria is not a contagious, allergy. So if somebody is having urticaria, you should not, stay away from that person, because we have seen that people usually scare that if somebody is using, my towel or something, it can pass it on. But as said by the doctor, urticaria is not contagious. Doctor, when we were talking about urticaria, we have seen during COVID, so many people have allergies and the redness. So can COVID cause hives or urticaria on the face as well?
Yeah, as I already said, stress is the very important key factor for triggering urticaria. COVID was a pandemic situation for everyone, and everyone were affected in various ways. So all those stress factors will induce urticaria.
Okay, so stress can definitely cause urticaria. Doctor, as urticaria is red in color and itchy, it is as well. So the stress urticaria looks different from the chronic and acute urticaria, or is the same?
The clinical manifestations are the same. for stress induced also. Where we have to classify acute or chronic. The thing is that when the duration is very less, when people enter the clinic that I had itching, redness for the past 1 week or for the past 10 days, we'll give symptomatic treatment and we'll tell them that don't worry about this situation because stress factors also will trigger urticaria and make the acute one as chronic one.
Okay, and sometimes people are stressed because they have urticaria. So they are stressed because they are having urticaria.
Yes, they will be thinking, I had some food, new one from a new restaurant somewhere. I was traveling a lot. So I developed this lesion for the first time, and it's here for the past 2 days. I have these reactions. Will it settle down or not? Is there any tests required or not? So we'll give the treatment, we'll give the antihistamines and topical preparations, all those things. The treatment will be given as per the protocols, and we'll tell them don't get panic about this because that will trigger urticaria.
Yes, so be stress free. Don't stress about your urticaria because dermatologists are there to help you to treat your urticaria as well. So don't stress because, as doctor already told us, that stress can cause urticaria and they can convert your acute urticaria to the chronic urticaria. And doctor, when we were talking about urticaria, uh, the question is it like that urticaria can make someone tired?
Yes, it's because of the symptoms. People will be going on having itching or redness all over the body, which is very much the patient cannot tolerate at all. They'll be telling that I have been scratching the whole night and I was unable to sleep. So when it is disturbing the sleep, automatically everything gets disturbed.
Right. So if someone is not sleeping properly, it have its own causes. And as you mentioned that, in the night urticaria itches as well. So is it like that hives or urticaria get worse at night?
Yes, coming to the thing which is getting worsened at night is that in person, if we ask the history to the patients, they'll be telling that I'm working the whole night and I'm taking rest in the day. So I have sufficient sleep of about 7 to 8 hours in the day. But that's not the thing, right thing. In the night, what has been regulated has to be done because there is a specific hormone which induces sleep in the night, which is known as melatonin. That will induce sleep, and there are hormones which has to be secreted only during night. In the day, there are certain hormones which have to be suppressed and which has to be released. So this is the normal circadian rhythm of an individual. So when we try to change the routine, then the hormones, everything will be confused. That will also increase the hormonal imbalances, which triggers urticaria.
Okay, so it is true that the urticaria will worsen at night because there will be a lot of changes going in your body.
Yeah, people will be working in the night, the whole night, and they'll be sleeping. And some of them will be having a shift of night for 15 days and the next shift for the day. There will be a change after that. All those things will trigger urticaria.
Okay, so these are all the factors which can trigger your urticaria. So make sure that you take proper care of yourself because, as doctor have already told us that urticaria can be worsened if not treated well. And doctor, when we are talking about the acute and chronic urticaria, what are the different treatment options which are available for urticaria?
First, according to the classification of acute or chronic, we'll be deciding the treatment. If it is an acute urticaria, we'll give antihistamines in the night and we'll give the topical preparations in the morning as well as night, and we'll watch whether the symptoms are getting subsided or not. If it comes under chronic urticaria, and we have to suspect certain infections also, and we have to add on certain antibiotics with that to be relieved of the symptoms. With that, antihistamines will be added to relieve from the symptoms.
Okay, so there will be different treatment options for classifying as acute and chronic. If someone is having acute chronic area, there will be different treatment option. If somebody is having chronic urticaria, the treatments will be different. Doctor, sometimes people don't take full dose of their medicines. They just left it because if they take 2 3 days medicine and the urticaria is gone and they feel that it's okay to not to take medicine. What is your take on not taking medicines and on the full dose? If someone is not taking the full dose, can urticaria can come again due to the if it is left in like treated on the way in only?
Yes, urticaria is basically a histamine release from the mast cells. So, when we give a dose of antihistamine in the night, most of them will be relieved from the symptoms within 1 or 2 days. So, people have the tendency, anyone have the tendency of stopping it within 1 or 2 days. They'll be feared to take a medicine for a long time. So, when you stop that, the thing will not subside. Urticaria will not subside. The intensity will be worsen more, which will start after months or weeks, even weeks. So after the half-life of the drug has been depleted, the people will be getting the symptoms, which will be 2 to 3 folds more than before.
Okay, so you have to, take full dose of your urticaria treatment. Doctor, we also have a live viewer question. Monica Sharma is here and asking, how long do urticaria episodes typically last in teenagers, and what can I do to relieve the symptoms?
Yeah, uh, usually we'll be giving the treatment, whatever the tablet or creams, usually we'll be giving for 2 weeks. So it is to control the histamine release and to calm down from the symptoms. On an average, we tell around 2 weeks. If it prolongs beyond that, then the treatment will vary according to the reasons.
Okay, so 2 weeks, there is we see that is it increasing or not, and if it is increasing, then another test is done, right, doctor?
Yes.
Okay, so there is another.
Uh,
Yes, yes, please. Go.
And one important point is that what I want to tell is that there is a strong correlation between dental caries and urticaria. Dental caries or any focus of infection in the oral cavity will not be giving symptoms or symptoms like pain or discomfort at all times. Silent focus of infection in the oral cavity also will trigger urticaria. For example, when we ask the patient when they enter with the symptoms, what I already told, and we'll classify as acute or chronic urticaria, and we'll ask them whether you have any dental caries, and people would be saying that I have caries for a long time, but it's not giving me any pain or discomfort like that. So that is also an important point that has to be taken into consideration, that will trigger urticaria. So oral cavity also have to be taken care properly. The dentist opinion is also needed.
Okay, so you have to take care of your oral cavity as well. And if you're facing some kind of problem and your oral cavity, you should definitely consult some dentist, because as doctor said, that oral cavity can also trigger urticaria. And I think this is something, which everybody should know, because we have already talked about the sunlight, the food triggers, but oral cavity can also trigger urticaria. That is point to be noted, doctor. And doctor, we have Rohit John, our viewer, and he's asking, are there any specific test or a diagnostic procedure that can help identify the cost of urticaria in adults?
Yeah, coming to there are lab tests. As I already said, we can do complete blood count, ESR, and ASO, C-reactive protein, thyroid profile, all those things can be done. And coming to the skin tests, there is also a test called skin prick test. We'll be doing it intradermally so that we can identify the intensity of urticaria.
Okay, so these are the tests which are available for identifying the urticaria. As you mentioned, the skin test is also available for identifying the urticaria. As the questions have come, doctor, that causing the urticaria symptoms in adult, is it like that, that the teenage or the adults only have urticaria? Does urticaria have any, age limit that, the children or the teenager and the adults can only have, or is it like anybody can have urticaria?
Anybody can have urticaria. There is no age limit that only this population have to have in this teenage or like that. It's not like that. It can, but theoretically, when we study, female ratio will be more. But nowadays, it's not like that. Equally, people are facing both male and female, and even kids also have a lot of urticaria.
Okay, so it can happen to anybody, and whenever you see something like that, please consult your dermatologist. And we were talking about how to identify, how to treat it. Here comes a question from Akansha Puri asking, can urticaria be prevented naturally?
Coming to the natural part is that what we tend to stress the same point is that not to do any home remedies. That's the first point, because application of coconut oil or turmeric or whatever home remedies. Why we want to say that coconut oil shouldn't be applied is that it can trigger another diagnosis. Like there is a hair follicle infection like folliculitis, or it can trigger other issues. Initially, it will be you'll find that it's getting over, but it's not like that. It's getting absorbed and it's triggering other situation. So avoidance of home remedies would be better. And coming to the stress factors that we have got these lesions, thinking of that also will trigger. And on a safer side, you can apply calamine lotion alone and then you can wait if you want to treat it naturally.
Okay, so treating naturally, as doctor said, can be have different causes and different effects on you. Doctor, there is Millie Agarwal asking, are there any lifestyle changes or home remedies that can help elevate my child urticaria symptom?
Yeah, every day we see a lot of kids getting urticaria, and the intensity is very high also. They have a lot of reddish lesions all over the body, which the child is suffering with itching. All those things are also being noticed in the recent years. It's because of the food what we are taking every day. The kids are getting exposed to lot of junk food, and we may they are also stressed with the thing what they are studying every day. All those things can trigger urticaria from the kid side. So we have to keep a watch on the food what they are taking, and wherever they are going for a play, like whether it's full of plants or any triggering factors are there, or any mosquitoes, all those insects also can trigger urticaria. And one important point is that, as I want to say, is that like dental caries, worm infestation also will trigger urticaria. So a deworming has to be done for kids regularly, once in 6 months.
Okay, so it is important to take a proper eye on your kid, that where he is going, what he is eating, because that can also trigger urticaria. Doctor, there is a question coming from Gini Sharma, that how can I differentiate between urticaria and other skin conditions if have similar symptoms?
Yeah, urticaria, I already told its appearance and disappearance of lesions. So the lesions will be coming and going.
Yes.
That's the first point, what people can easily identify. The rest of the things like infections or other allergic reactions apart from urticaria will be identified by us.
Okay, so urticaria is, appearance and disappearance. So you can differentiate between urticaria and other skin conditions. Doctor, there is a question from Shilpi Yadav and asking, are there any specific precautions I should take during pregnancy if I have a history of urticaria?
Yeah, pregnancy, it is basically a hormonal imbalance. It's a huge hormonal imbalance situation. So there are a lot of conditions in pregnancy that will trigger urticaria. And the medication which has been given to them, there will be a single group of drug which can be given in pregnancy. So that alone can be given in pregnancy as well as in breastfeeding to control the symptoms.
Okay, doctor. Doctor, there's a viewer Deepak, and he's asking, are there any specific precautions I should take to prevent future outbreaks of urticaria?
First thing, a proper lifestyle is needed, a proper daytime work and a proper night sleep. That's the first lifestyle change which everyone has to do. And proper timely food has to be taken. All those things will regulate the hormonal imbalances so that you won't tend to move towards urticaria.
Yes, definitely. And we have discussed about the stress urticaria, but there's a question from Gaurav that how does stress or anxiety impact urticaria and what can be done to manage these factors?
Yeah, when stress, everyone will be having stress like in their work or some personal thing or all those things. In that stressful condition, there is a substance called free radicals which will be released in the bloodstream. And that is an unwanted substance which is responsible for urticaria. So body is not capable of depleting the free radicals of its own. So we end up in urticaria. The thing is that the stress has to be kept under control.
Yes, so be stress free. That can only help you and helping not causing urticaria. Doctor, we have discussed about the symptoms, the causes, the prevention. So before we end this live session, any takeaway message for all our viewers watching this live?
Yeah, the thing is that what we have to keep in mind is that go for a dental checkup regularly, once in 6 months. Follow a deworming tablet once in 6 months, and a proper lifestyle management. Stress to be kept under control, and to avoid home remedies.
Yes, avoid home remedies, control your stress, and do not self-medicate and go to your nearby dermatologist if you are having any symptoms or signs of urticaria. Thank you so much, Dr. Swathika Udayakumar, for your valuable time.
Thank you.
And it has been a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case they get to see such symptoms, they now know that instead of self medications, it's better to approach a nearby dermatologist. And it is great to hear you, and we really look forward for many more such sessions in the coming time with you for our viewers.
Thank you. Thank you for patient hearing, and it's happy to tell everyone.
Thank you. Thank you so much, Doctor. And thank you, viewers, for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page or about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you so much and good day to all.